Hi everyone, I'm Marissa, a certified trichologist here in Los Angeles. I've studied over 100,000 scalps in the past 20 years, and I've seen the same things over and over again. Dandruff, itchy scalp, oiliness, even extra shedding. And people tell me, I've tried many shampoos, but nothing works. If that sounds familiar to you, stay with me, because today I want to show you what might actually be going on, what you can do about it. When fine flakes keep coming back, even after you wash, when you notice a strong oily smells by evening, or your part looks red and irritated, those are not just surface problems. They're often a signal that inflammation inside your body is out of balance. And yes, that can show up right on your scalp. Your guts and your skin are connected. Your scalp is a skin too. When your gut is inflamed, your immune system overreacts. Your scalp barrier weakens. You end up with flakes, irritation, oil imbalance, and sometimes even hair loss. That's why we can't just treat the outside. We need to look at what's going on inside as well. But gut health isn't the only piece of the puzzle. Research shows that seborrheic dermatitis can sometimes be worse in people with a higher BMI, and there may even be a link with a metabolic issue like insulin resistance or fatty liver disease. Although that's still being studied, hormones, especially androgen that increase oil production, are another big factor, which is why seborrheic dermatitis often starts at puberty. So when we look at scalp health, we want to take a big picture approach. Gut health, metabolism, hormones, and lifestyle all play a role. In my salon, clients who always have dandruff are actually very common. During a consultation, I often ask them, do you often feel bloated? Or do you have any food tolerance issue with us, such as dairy or gluten? And most of them say yes. This is one of the clearest patterns I see. Gut imbalance can issue go hand in hand. When I check their scalp under a camera, I usually see redness and irritation. The flakes and oil buildup clogging the follicles. In many of these cases, what we're really seeing is seborrheic dermatitis. This is not just a dry scalp. It's a mix of inflammation, oil imbalance, and yeast overgrowth. And the care for this is very specific. If you have this kind of scalp, you actually need to shampoo daily or at least every other day. I know some people think washing less will help, but when you don't wash regularly, bacteria and yeast feed on the oil and dead skin and make it worse. Irritant shampoo pre-rinse for at least a minute with a scrubbing with your fingers. Rinse after shampoo very thoroughly and use a lukewarm water. Adding an antifungal shampoo once a week can make a big difference. Yes, medicated shampoo, zinc, selenium, sulfide, ketoconazole can help. If you overuse them, they strip oils, dry the scalp, and cause inflammation and more flakes. So I recommend to use it only when it comes worse. After you wash, always dry your scalp before bed. Please don't go to sleep with wet hair. Warm, damp scalp is the perfect environment for bacteria and yeast to grow. At the very last, the simple step alone can reduce irritation and flakes. For daily care, think of this as a rhythm. Pre-rinse, cleanse gently, rinse well, dry completely. And dry shampoo is fine once in a while in emergency, but don't rely on it daily. It can build up and make the problem worse. It's called shampoo, but it's not shampoo. You know that. Once a week, add a gentle clarified wash and brush your scalp to distribute oils and remove buildup. This combination keeps the scalp balanced and clean without overstripping. Now let's talk about the inside. I encourage my clients to try simple 21-day experiment for 3 weeks. Cut your sugar, dairy, and gluten. Eat a well-balanced diet with a palm-sized portion of protein at every meal. Add fermented food and fibers such as yogurt and sauerkraut, miso, kimchi, seaweed, natto, vegetable, oats, or beans. Include omega-3s from fish, nuts, seeds, or supplements. They help reduce inflammation and support scalp health. And don't forget hydration. Drink plenty of water. Many people notice redness, itchiness, and even scalp odor fade when they do. Stress and sleep matter. Turn off the screen about an hour before bed and get some daylight every day to calm your body and your scalp. Hopefully your itches, flakes, and oiliness will improve. If your symptom lasts longer than a year or suddenly get worse, get blood work done. I recommend thyroid, hormone balance, iron, vitamin D, zinc, and see a dermatologist. Follicular dandruff isn't just a surface problem. Daily scalp care plus internal care transform your scalp health. If this was helpful, hit the like and subscribe and drop your question in the comments. And if you're in Los Angeles, you can find the link to book a head spa session in the description.